Okay, let's start our webinar today. Good morning, doctors. Welcome to join the webinar about TCM for female infertility presented by Dr. Dongyun Liang. I'm Grace Paul, founder of Yonghua TCM Center. I'm also the host for today's meeting. First, please turn off your audio and video so that you can hear the lecture clearly without any interruptions. Please do not ask any question when Dr. Liang is giving lecture. Q&A is set aside for the end of the webinar. Let me briefly introduce Dr. Liang. Dr. Dongyun Liang, a licensed Chinese acupuncture physician in Miami, Florida, US. Chief physician, lecturer, and professor. She graduated from Shandong University of Traditional Chinese Medicine in 1982. She has worked in Gynecological Hospital and the Cancer Hospital in Shandong Province for several years. Later, she served as a director of the Department of TCM in Shandong Chest Hospital and became a member of the National Respiratory Disease Committee. She won the International Outstanding Achievement Award of TCM. She came to the United States in 1996. She worked as an academic dean and taught at Miami College of TCM for many years. She is fluent in English and gives vivid lectures, deeply loved by American students. She tours in North America and Europe as TCM lecturer. She summed up a complete treatment system suitable for overseas Chinese medicine in the treatment of infertility. She integrated the 8 principles of traditional Chinese medicine into the basal body temperature, BBT, of women's menstrual cycle and found variable diagnostic and treatment commonalities. That is, through the changes of BBT in each stage of the menstrual cycle, find out the imbalance of the yin-yang, excess and deficiency of the internal organs, thus providing a scientific basis for the treatment of infertility. She uses acupuncture and Chinese herbs, treated a large number of infertility patients, and enabled countless patients diagnosed with lifelong infertility by reproductive doctors to successfully conceive. She is currently a council member of the TCMAAA Gynecology Professional Committee in US and the Reproductive Committee of the World Federation of Chinese Medicine Societies, the Vice Chairman of the Foreign Exchange Committee of the World Acupuncture Federation. She is the director of the Miami Oriental Therapy Center in US. The editorial board member of the Journal of TCM of Shandong, the distinguished senior expert of the China-US Rehabilitation Institute of Wenzhou Medical University, and the guest professor of the PhD program of the 5 branches of TCM University in California and Minnesota University in US. She is the founder and president of the Overseas Alumni Association of Shandong TCM University. She has published more than 30 papers in academic journals in China and abroad, including how to use TCM differentiation to interpret female basal body temperature, TCM treatment of male Y chromosome deletion infertility, and acupuncture treatment of refractory infertility, have high clinical practical value. And her BBT TCM differentiation therapy has been adopted by many overseas TCM practitioners and also has achieved remarkable results, opening up new ideas for the application of acupuncture and Chinese medicine in the field of overseas gynecology. She has extensive clinical experience in gynecological diseases, menopausal syndromes, incurable diseases in internal medicine, and refractory male and female infertility. Well, let's welcome Dr. Liang to start today's lecture.
Thanks for a brief introduction. Hi, everyone. And my name is Dongyun Liang. I'm practicing acupuncture and Chinese medicine in Miami, Florida, United States. I'm very glad to be here. And today, my topic is strategies of TCM in the treatment of female infertility. And in actually recently few years, so the infertility problem, more and more people, and they are looking for help, especially for acupuncture treatment. I think, we have got good results and with the acupuncture treatment. First, we need to know a few like a very important definition for infertility. In 1990, WTO redefined conception of the infertility. And I will say like many years ago, and that time, and normally it's for infertility, and the definition is like 3 years, and after try 3 years without any successful pregnancy is called infertility. Now, no, they just redefined the definition. That is normal sex life without any pregnancy in 1 year, not 3 years, only 1 year. Failure to conceive, this is called infertility. Infertility can be divided into 2 types, primary infertility and secondary infertility. And primary infertility is without any previous pregnancy. Secondary infertility, and they got pregnancy before, but unable to conceive again. And even they don't have children, but they got a pregnancy before, but miscarried. That's still called secondary infertility. And generally speaking, and the secondary infertility more difficult, the treatment than primary infertility. Another conception we need to know what's the advanced infertility. So because a lot of patients, they don't have any knowledge about this. So when they come over, they're already 38, even 42, they still don't worry about anything about fertility. So as a doctor, you should educate your patient. So if the age over 35 years old and without pregnancy, and that's called advanced infertility. So after 35 years, and that ovary function decline. So of course, more difficult for the treatment. So if you tell the patient, then sometimes they just realize it's the problem, they should pay attention, start to get the treatment as soon as possible. In 2015, American Fertility Society added more regulation for infertility. If the age between 35 to 38 are considered infertile if no pregnancy occurs after 6 months of the normal sexual life. That's not for 1 year. The age between 35 to 38, only 6 months to try. So if not pregnant, these are considered as infertility. If the age over 39 years old are considered infertile if no pregnancy occurs after 3 months of the normal sexual life, only 3 months left for age over 39 years old. So more older, more limited time. So that's why. So definitely when people, patient come to you, even with they have other issue come to you, and on their file, they will tell you they get married, they have kids, and if they don't have children, they got married, and just ask them, how many years did you get married? Like, do you have children? Look at these kind of questions. I have a lot of patients, if you ask, they say, I'm not ready. I don't want to get a baby now because I'm study PhD program. I don't have a house. They are not ready, but their age already over 40s. So, really cannot wait. So sometimes I just tell them, let me tell you what's the, definition of the infertility. So I tell them, my God, nobody tell me about this. I really don't know. That's why I always tell them, think about when you are, don't wait more longer, more difficult in the future. So, okay. And what's the multi-factor difficult infertility syndrome? That includes so many issues, like advanced age, over 35 years old, recurrent miscarriages, PCOS, POF, blockage of the fallopian tube, and the sperm eggs poor qualities, severe endometriosis, deformity of uterus, early or later ovulations, not on time, and no ovulation at all. And another condition, most patients, because they tried many years, even they tried IVF, IUI, didn't work for them. They are mentally, physically, and financially, they are very exhausted, very stressful, so very emotional. So that conditions definitely can cause, infertility. And antibody. So normally after 3 times IVF, they don't get, successful, results. Then the IVF doctor will refer to the specialist, to do further test for antibody, and especially non-explained infertility, husband sperm normal, and the wife hormones normal, they just don't get pregnancy even with IVF, IUI. So that kind of condition, mostly over 70% patients have antibody in their system. So anti-sperm and autoimmune disease, this kind of stuff. According to TCM, and we do pulse diagnosis, tongue diagnosis. And most of these kind of patients, their pulse, especially kidney pulse, 那个寸关尺脉啊，the kidney pulse always deep, thin, and weak. And the tongue diagnosis can show up like a sunken and uneven, like this. This image includes there's 2 persons pictures. The left one is one patient. Generally speaking, and tongue diagnosis, the tongue body can be divided into 3 parts. And the first 1/3, that we call shown up we call upper jaw, that include heart and the lungs. And the middle jaw, that's in the middle tongue. And that includes spleen, stomach. And the lower jaw is the tongue root. And look at this patient, left the picture. The tongue root supposed flat, and this patient looks like a big dip and sunken. And you can see on the left, the tongue roots in the middle of the left, that area, there is small, like a small, like a nodule over there. So that's uneven. That's both sides. That just refers this patient maybe has like a fibroid in the uterus. Sometimes like PCOS patients, you can see a lot of the small nodules on the both sides of the tongue roots. So that's very useful for diagnosis. Look at the right picture. That's same patient, 42 years old, primary infertility. Left one is before the treatment. So you can see the big sink and in the middle of the tongue, big hole over there. So after treatment, after 3 months treatment, and her tongue looks flat, the big hole completely gone. So that's, and she got a pregnancy after 3 months. So how different before and after. So that's why tongue diagnosis and is really important, can tell us more information. Like one patient who had like she called, she said for infertility treatment. And then when she shown up and before the treatment, she didn't put it, just put it the chief complaint just for the infertility. So I said, let me check your tongue first before the treatment. And when she shown up, her tongue made me scared. So her tongue, huge, big lump over there. Right away, I realized she had huge fibroid. And I said, please lie down. Let me check for you. When she lay down on the table, look like a 7 months pregnancy, huge fibroid, very, very hard. You couldn't, move at all. And I said, you have fibroid? You don't know? And she said, yes, I do have 20 years ago already told me. I said, why you don't get treatment? And she said, oh, doctor want to remove my uterus, but I want to get a baby. How can I remove my uterus? But, just from the tongue, we can see. And also like a hypothyroid, the patient, you can see in front of the tongue can show up. It's a very interesting tongue diagnosis. In China old book, Neijing, and that mentioned they have a record about the reproductive physiology of woman whole life from like 7 years old until 49 years old. Like this picture, we can see this like a semicircle and picture, and is a very vivid image to show up the woman's reproductive function during a different ages. Left side, see the 7 years old grown up, this 14 years old, 21 years old, and until top, it's 28 years old. So top one, you can see the blue line more thicker, more darker. And that means that's for fertilize, very good. Fertility, function is good between this area, top one. After 35 years old, the line going down, and they become too thinner and lighter until, the 49 become to the menopause. So this is just the very simple pictures, but it will tell us the woman's whole life of the reproductive system functions. This page included two pictures, top one and below one. And that's just to tell us as the female hormones in the whole cycle and the uterine lining, how changed during the different days. So that's the whole cycle is 28 days. We look at the top one. And the green color is FSH, and the pink color is estrogen. The yellow color is progesterone. The gray color is LH. So when we check ovary function panel, we always ask them, go to get blood during the cycle day 2 to day 5. Why? Because look at the first menses during the period, all of the hormones stable. So this time you give blood will tell you the more accurate information. And the estrogen and the before ovulation will start big jump. That's estrogen surge. That's the first surge. And then gradually after ovulation going down, then during the luteal phase, the second surge, and that's two surges, estrogen. And the gray color is ovulation, LH surge, and before ovulation started going up. And then day 14 of the cycle is, that's peak. And that means it's ovulation time. So after ovulation, LH, start to drop. The progesterone, the yellow color, after ovulation, the ovary has fast response to the ovulation. And the ovary start to produce a large amount of progesterone, and they make a progesterone level goes high. So that's why when we request they check progesterone, we always said, go to get a blood test for progesterone during the cycle day 21, 22, that time. So that will tell you, how high and his progesterone during the luteal phase. If get a pregnancy, the yellow color, the progesterone will keep high level, non-stop, non-drop. And if not pregnant, and it will drops and start next cycle. And that's new cycle beginning. So the bottom pictures, and when get a period, and look at the lining start to become too thinner. After finish period, the lining of the uterus is the thinnest day. Then gradually goes thicker, and after ovulation, more thicker during the luteal phase. Look at under the lining, so many capillaries, blood vessels over there. So why? Because they are prepared for the embryo implantation. And in case and they get pregnancy, they need, the embryo need more blood supplies from the capillaries, the blood vessels, and the thickness of the uterine lining just protect the embryo, that the embryo stay there more safely. So if you get a pregnancy, the thick lining, like always like this. But if not get pregnancy, the start a new cycle, and it will start another cycle, then same and repeat another cycle, and then they will get bleeding, then the uterine lining become thinner. That just lets you know, like if you understand the two pictures, you will know what's going on. Like during the period, the hormones level and the uterine lining, and the one is estrogen stronger, and one is the progesterone dominate. One is the LH surge. So that's, if you understand all of this, can guide your treatment. When, woman over 40 years old, and increase the risk of the infertility, because it's hard to get pregnant after 40 years old. Why? Because their FSH increased, their AMH decreased. So FSH, and it's the very important number to see how fresh the follicles. And most people after 38 years old, ovary function decline, FSH goes higher. And a lot of people, when they come over, they already it's belong to advanced infertility at their FSH, most over 20, 30, 40, 50, 60, more higher and more difficult for the treatment, because that already close to the menopause, or even looks like post-menopause numbers. And anti-malarial hormones, AMH, that refers to patient in ovary reserve condition and the egg count and how many eggs left over. A more older, AMH more low, which is normal condition. But some girls, even they are young, 35, 37, not over 40s. So AMH already very low, and sometimes 0 point something, so below 1. So that's almost, I did treatment for one girl only 34 years old. So unbelievable. In her AMH 0.01. Of course, she didn't have like a period 2 years, and the hot flashes, and the night sweats, and the loose hairs, fatigue, and the vaginal dryness. So all of symptoms look like a menopause. Only 34, and married 2 years, tried to get a baby. When she went to fertility center, they checked her hormones. Her FSH 49, her AMH 0.01. So the doctor said, impossible. You don't have leftover eggs. So, and so the only chance, maybe adopt some child. And she's very upset. She said, "Can I get IVF?" Of course, they are not accept her because she's not qualified. And they send her to me. When I saw this kind of condition, yes, her skin very dry. And she cried. She said, "I know I don't have any hope to get babies, but I just want to get help from you. At least let me get a normal sexual life," because her husband only 32, too younger than her. She's so upset because she couldn't do intercourse. Too much pain for her, very dry. So for me, also I said, it's very difficult cases. I said, let me try the best, but don't think like, and you get good results in short time. You have to be patient. She said, okay, whatever you say, I just follow your instruction. So because no period. So at the beginning, I gave her acupuncture, electrical acupuncture, and the herbs tea. after like a, short time, 2 weeks, she started to, get the period, very little, and the spotting, but at least, got it. So I said step by step, and the second month, and she got period, heavier, but no ovulation. So the BBT, the basic, the body basic temperature looks like one line. And after 3 cycle treatment, I increased the electrical stimulation because the ultrasound shown up her ovary, both sides and shrinking, and like a baby, the ovaries. So actually, that girl, after 4 months treatment, she start have like a ovulation, and all of the symptoms, the menopause symptoms gone. She start have like a discharge, vaginal discharge, and she's so happy. But still, we don't think she can get pregnant by herself. I just told her, let's try, and still keep my treatment, don't stop. And we maybe some miracle thing happened. Actually, this girl total together, I did the treatment 6 months, and she got a pregnancy. It's unbelievable. So for her condition, mostly nobody can believe, but it just happened. Okay, in China, most TCM gynecologists use herb formula during the treatment for the infertility patients. But overseas, we used more often with acupuncture combined with Chinese herbs. Especially for multi-factor difficult cases, like advanced ages, this kind of condition. The combination method are very useful and more effective. It has been approved by clinical practice and research in past years, especially FSH, and you can see every month, and if you check, they start to drop from 40 to 30 to 20 and to 10. So it's very fast, good results. AMH and increase a little bit, not fast as FSH, but still, gradually go back. So, but from the theory, AMH only more and more less. But during the treatment, after treatment, few months, you can see AMH also can be changed. What's the menstrual cycle therapy with TCM? Generally speaking, the whole cycle can be divided into stage 1, stage 2, stage 3, stage 4, like 4 phases. And the phase 1 is menstrual bleeding period. Phase 2, and the after period, post-menstruation. Phase 3, ovulation time. Actually, the phase 1, 2, 3, that together we call follicle phase. Phase 4 is after ovulation, and that also can be called luteal phase. So the whole cycle we'll see like include follicle phase and luteal phase, two phases. Now we start to talk about the treatment. So phase 1, the principle is clear stagnant blood, invigorate blood, and resolve stasis in order to discharge the old endometrial linings. Get ready for uterus lining refresh. The purpose is called, clean the house. And this is the cleansing time to invigorate the blood, clear the old, like a dead tissue from the uterus. And the earth to be soft and further ideal for planting. Like when we planted like some you know, trees, flowers, and vegetables, and we have to like you know, clean the soil first, right? So we will take out the stone and the hard stuff, and then you know, make the good quality. We should buy very good quality, high quality seeds and plant it, put it inside, and did that. So during period time, the purpose same as like a planting. During this kind of treatment, the patient will expect they have more blood clots during the menstruation. So mostly when you give them this kind of treatment, they always say, oh, this cycle more heavy bleeding than before, especially for old patient, for advanced infertility patient. Their menstruation very little compared with like 5 years ago or 10 years ago. So which is already their ovulation, their ovary already decline. If their menstruation become too heavier, it's good sign. So acupuncture, we can choose abdominal points like Ren 2, Ren 4, Ren 6, and Zigong. Zigong means uterine points. Spleen 6, spleen 10, and liver 3. And herbs, we can use Tao Hong Si Wu Tang, and you can get, you know, Chinese patent medicine. You know, they already made it in the pills. Okay. So Ren 4, Ren 3 in Chinese, we call Zhongji. That's middle extremity and front move points of the bladder and the meeting points with the spleen, liver, and kidney channels. So Ren 4 in Chinese, in Guanyuan, the gate of the original qi, tonify yang. Ren 6 in Chinese, qi hai, the key point where the upper low air engines intersect. Zigong is a projection area of the ovaries, make more blood flow in ovary and promote ovulation. That's good for ovulation delay or no ovulation patient, especially for like PCOS, difficult to get ovulation. So you can use surrounding needles, you know, in these points. When the one needle is in the like one, depends on the patient. If a fat person, you need to use a little bit longer needles. If skinny people, you just use, you know, one inch. So for me, normally I use like because American people, most people overweight. At least I use 1.5 inch needle, and directly put in Zigong with vertical like puncture. And from Zigong point up 1 inch above, below, left, and right. So with 45 degree and insert to the center. So that called surrounding technique. So to stimulate the ovary. And liver 3, Tai Chong, soothes liver and regulates qi. It's very good points for any kind of emotional like, problem, depression, anxiety. At this point, very good. Spleen 6 in Chinese, San Yin Jiao, first points of the spleen, liver, kidney, meridian. And that's also good points. The spleen 9, Yin Ling Quan, tonify spleen, eliminate dampness. Spleen 10, in Chinese, 血海, sea of the blood, harmonizes and nourishes qi and blood, cools blood and clear heat, improve blood circulation and eliminate the clots. So during the period, you better use the spleen 10. And it's very good, especially for people who have like blood stagnation and the cramps during the period. That can make clots come out easier and sooner. But if the patient has heavy bleeding already, if they have fibroid, so they got heavy bleeding, lingering bleeding, more than like 15 days, spleen 10 better do not use. But the first 3 days you can use. After that, do not use this point. And herbs, 桃红四物汤, that's the ingredients that we don't, you just remember the name. Okay, phase 2. After period and the treatment principle, we should nourish yin. Like we already put the seeds inside of the hole. So, and this time we should give, fertilizer and put in more nutrient to that location. So in Chinese terms, we just should give them tonified blood and essence, regulate Chong and Ren, stimulate mature follicle, and make uterus membrane generation. Like a farmer adding fertilizer to the soil, providing enough nutrition for the seeds grown. Acupuncture can be used here. We should focus on yin meridian, yin channels, like liver 3, spleen 6, spleen 9, kidney 3, kidney 6, Ren 2, Ren 4. And so it's because the after period, this is a very important time because follicles start to grow this time. So they really need more nutrition. So the yin meridian, because 3 yin meridian, all of 3 yin meridian go up, like a liver, spleen, kidney meridian from foot and the inside of the feet, and it go up and then connect with the internal sex organs. So that's why we focus on yin meridian this time. The herbs, we give them 六味地黄丸, that also is called 6 flavor pills, 6 flavor tea pills. That tonify kidney yin. And liver 3 in the, we call Tai Chong, great rushing, promotes flow of the liver qi and calms mind. Spleen 6, San Yin Jiao, and 3 yin meeting, nourishes blood and yin. Spleen 9, Yin Quan, yin month, spring, remove obstruction, benefits lower jaw. Spleen 9, this point, when you, use this point before you put needles, better use your thumb to check and inside of the knee. So when you feel, that area, you can find some like a location. There's some point very sensitive. Sometimes you feel like a small hole over there. That's exactly place you should put the needles. That's spleen 9. So, some doctor just they put the needles over there. So that's, if you check by yourself before put the needles, you will get good results because you put exactly the location, and the patient needs. If you feel like a small hole over there, that means deficiency, empty over there. So really you need to put the needle over there. And kidney 3, Tai Xi, greater stream, tonifies kidney, benefits essence. So that's very good points. Kidney 6, is also called 照海 in Chinese. Shining Sea nourishes yin, invigorate yin qi. Kidney 6, that point also good for people who have sore throat and internal heat. So that you can use this point. Same thing. So below the ankle, inner ankle, the point. So if you push, you can find some location, the patient will feel, oh, I feel more sensitive, I feel pain over there. Okay, that's the place you need to put the needles. And then for 6, that's Guanyuan and Qihai. Tonify yang and qi, open rim channels. Liu Wei Di Huang 1, 6 flavor pills. That ingredients, all of this is natural. It's like yams, and, we don't talk with, there's another formula called Sogiwan, similar as 6 flavor. It's 25 yin. Okay, ovulation time, phase 3, ovulation time. And the treatment principle is unblock channels, dilate fallopian tubes, promote quick discharge of egg, help the patient to get ovulation. And during ovulation time, especially the people like, try so many years and they don't get any results, they feel so frustrated, like, then they're depressed and anxiety, anxious. This kind of people easy to get, like a ovulation delay. And during ovulation time, because the emotional condition can cause fallopian tube like a spasm. And when egg try to, get out or get pinched and they got injury. So the difficulty become to embryo. That's why we needed to, another reason, the fallopian tube very narrow. So the temperature higher than uterus because, narrow tubes. And so if the eggs stay there too long and, like 3 days, 5 days, still not release eggs. So the eggs doesn't work. The eggs already, either died inside of the tube, either already, or no energy. And that's difficult to become to embryo also. So that's why very important during ovulation time, we give them, stimulation, try to let them get ovulation as soon as possible. Acupuncture points. Normally this time we can use heavy points like stomach 36 and it's gone like I just mentioned, surrounding needles, 5 needles together in these points. And the purpose is to dilate the fallopian tube, plus spleen 6, 9, 10, and Li4, Hegu. This point also sensitive. So, but more heavy, more strong, more sensitive points, more important, more useful during the ovulation time, and the liver 3. And the Da Cha point is master tones points, and that's also the sensitive, very sensitive points, but very powerful points, can open up fast for fallopian tube. During ovulation, we want to unblock the fallopian tubes, like unblocking the traffic en route. So the trucks carrying the seeds for the farm can get by. So the soil is ready, we make the seeds to get through. The eggs had to get out to the, and become to embryo, then the implant inside of the uterus. So herbs, we can use Chai Hu Shu Gan San. This is a very good formula to help them release egg sooner. Okay, that's the ingredients of the 柴胡树干散. Okay, phase 4, that's after ovulation. That's also is called the luteal phase. So in this time, we need to give them like a strengthen the young, promote the qi, tonify spleen, and warm the kidney. This is the time to boost the kidney, yang qi, nourish kidney yin. Like farmers cultivating their crops. Meanwhile, need to provide enough sun and rain. You know, when you like planted the seeds and you give them fertilizer, water, and during the follicle phase. But in luteal phase, meanwhile, they need to get the sun and the wind. And if no sun, you know, every day raining, the seeds will just die inside. And that is same thing. So we need, you know, yin and yang should be balanced. So acupuncture, we should use yang meridian, focus yang meridian points like a DO4, UB23, UB52, UB20, 四神聪, that's, you know, relax points. 四正位is umbilicus needles, and that's invent master qi. And plus spleen 6, 9, kidney 3. So herbs, we should give them 金匮肾气丸, that also called kidney pills from the golden cabinets. Another formula called 补中益气汤. They have like, you know, pills. Easy, if you just remember the name, it's okay. That's the golden cabinet pills. Oh, master tone gynecological points and the master qi umbilical points. That's 2 doctors. One master tone from Taiwan, the master qi from mainland China. So the master tones gynecological points, also called 妇科穴. 妇科穴 means gynecological in English. Used for any gynecological disorder. It is located at the first phalangeal bone on the ulnar side between red and white skin. Look at the first picture. That is 妇科穴 gynecological points inside of the thigh. And when you insert a needle with vertical direction. Second point is called 凤巢穴, phoenix ovary points. Normally used during the ovulation time. And that point located at the ulnar side of the ring finger between proximal and the distal phalangeal bone. And this is a second picture in the first here, the top picture in the right side. That's in the inside of the ring finger. 大岔穴. This point here, normally I use for, you know, like PCOS patients, no matter what kind of treatment, you just don't get ovulation. So you just use this point. That's very useful. Normally, if you know how to use this point, and the next day, they get ovulation. So the point, you can use 1.inch needles, not necessarily thick needles, thin needles from the web or from web's margin between the first and second metacarpal toward LI4. This way goes up. This point, you have to, you know, not too fast, slowly, a little bit twist, little by little, goes inside. Certain way is umbilical points used in luteal phase. This that's 4 needles from the edge of the belly button, up, down, left, right, 4 points with 45-degree. Put the needles. Then the top looks like umbrella. The handle of the needles, they touch together, top. So use the luteal phase. Why? Because according to Chinese medicine, the belly button and that include like 5 organs. So like heart, kidney, liver, lungs, and spleen. So this is tonification, very good. Increase patient young and increase patient energy. And so in luteal phase, we use that for, even people with like a chemotherapy and the very weak and tired. And so also very useful at this point. Okay, a few questions we need to pay attention. And some, doctor asked me, oh, Dr. Liang, so if you talk about the whole cycle, 4 stages, so different stages, different acupoints and different herbs. But if somebody they don't, according to the 4 stages, they get ovulation early, how can I do? Okay, if get ovulation early, the eggs immature, and normally the eggs, the follicles, so can reach to 18 millimeter, and during the ovulation, that's mature, good quality eggs can be released, and can be, can become to embryo. But if too early, day 9, day 8, you already released the egg. That's no good. The follicle size not reached to 18 yet, maybe only 15, 14. That's immature and premature. So that will cause, the cycle short. So get period early. So that time we can also, can fix this issue. So you can add some astringent herbs like to prevent early release eggs, like the name called 克子, 覆盆子. And then next cycle, you can see their ovulation delay a few days. That's so happy. So just remember, the red color, do not put needles in 子宫 points. If for patient who get ovulation earlier, don't use the points acupuncture for the ovary that area. If you put the needles in 子宫 point, it will make the ovary release egg more early. So make the cycle more short. So just remember this. And another condition is opposite. If ovulation delayed, the eggs over matured, and we can give them some herbs to promote discharge of eggs, like 穿心莲, lulutong. Then also this kind of condition, you should use the electrical stimulation acupuncture, especially on 子宫 points with surrounding needle technique. Like we mentioned, 5 needles in both sides ovary point area. That can stimulate the ovary, make ovary wake up, start to release egg. For best results, a patient should come twice a week for 3 months. If somebody very difficult because of financial problem, and we suggest they come here like during the menstruation and ovulation 2 times per month. because that's more important during the menstruation and the ovulation. So, it depends on the patient condition. So most time, unsuccessful cases are due to patient cannot follow your instruction, and they just this week they get treatment, next week disappeared, and then after 3 months showing up. This can never be worked. So you have to tell them since first time. Now we talk about clinical experience of acupuncture in fertility treatment. First, acupuncture treatment of infertility should be based on regulating menstruation and menstrual disease at first. Like I said, the ovulation is more important. If ovulation earlier, the cycle short, and that's why. And if ovulation earlier, the eggs will be like a premature. If ovulation delay, and eggs will over mature, also no good. So the cycle will be longer. So both conditions no good. So we have to adjust their menstruation regular, like every 27 days and 29 days, fine. Not 45 days, not like a 22 days, 25 days. So that's more important, because early, later, and irregular period will affect the timing of the ovulation. Second, choose the corresponding acupuncture meridian and points according to different stages of the menstrual cycle. And usually we use the liver, spleen, kidney, chong, ren, du, dai, bladder meridian. And they're more useful. And because those points are located on inner side of the legs, low abdomen, and the low back. They are directly related to the pelvic reproductive organs. And for example, acupoints such as like a uterus, stomach 29, ren 3, 4, 6, spleen 6, 9, 10, and baliao. Normally, we should focus on yin meridian in follicle phase and yang meridian in luteal phase. So acupuncture technique. So normally in China, they like to use the strong stimulation, heavy techniques, and they try to let patient get some strong feeling that called de qi. But in overseas, most patients, they don't like to get like a strong stimulation. So we, like in US, the Professor Li Yongming, and he invented soft acupuncture therapy. And Wang Shaobai, and he invented called sugar needles, also is pleasant acupuncture. Needle sensation, and in most time, everybody different. Somebody sensitive, somebody not. And sensitive people, they can, after put needles, right away they can feel something, and some feel warm, some you can hear like a bowel sounds, and feel heavy, sleepy, and some emotional, and they want to cry, and some can see different colors. So I have a patient, every time I put the needles, so after, finished treatment, she always tell me, doctor, let me tell you, today at the beginning after put the needles, I see the dark and like a blue and like cloud in front of my eyes. Gradually, the color become to lighter, yellow, red, green, and light cloud, blue, light blue, which is a good sign. So that's we, not necessary to use the strong needle to make them like painful and suffer. And even with the pleasant acupuncture, light, lack of stimulation, they still can get, like de qi. The frequency acupuncture is the key. And why? Because acupuncture increase the blood flow. So normally we suggest 2 to 3 times per week. But you know, if it's difficult for them, we just suggest at least twice a month during menstruation and ovulation times. Normally 3 months as one course, because the eggs need almost 3 cycles. You know, the new numbers of the eggs need almost 3 months to finish the growth. Electrical acupuncture, normally, and we use the during the ovulation time, and like a spleen 6, 9, 10, and then 3, 4, 6, and it's gone, and Baliao, then that points because they are connected with the internal sexual organ, so it's a very good. Okay, but why during ovulation use the electrical stimulation? Because makes fallopian tube, you know, accelerate discharge of the mature eggs in order to avoid ovulation delay. And with, you can use low frequency electro acupuncture during the IVF to prepare. It just make the more emerging, increase the essence blood flow goes to the abdomen. But in luteal phase, we don't suggest use electrical stimulation. That time, in case implantation happened, better do not use electrical stimulation. Okay, the age, and the more early, more better. So that's very important to just tell patients, don't wait, especially already over 35. Okay, so this is more important. And don't forget, soothing, regulating the mind, treating the heart and the liver together, needs to run through the whole entire process of the treatment of infertility, because this kind of patient always has anxiety, anxious, depression. So that, like, don't forget. So like a pericardium 6, heart 7, liver 3, 14, Taiyang, Intang, Sishencong, ear, Shenmen, ear, liver. So that points very, if you put needles, the patient can sleep or, you know, for like 30 minutes, it can get good results. All of the blood goes to the, you know, the place, you know, where you put the needles, not keeping, if you think too much, worry too much, the blood still keeping in the brain, and you don't get good results. So another thing we suggest for, you know, like a difficulty of the, you know, especially advanced infertility and old patient, we suggest the husband and wife together to, you know, get to the treatment. If the husband no problem, okay. So, but husband, we suggest just come over during the wife ovulation day. So they both get acupuncture that day, and nighttime you give them, you know, the homework in the course tonight. So, you know, so husband, wife as a team, and, you know, they make a good energy together, balance each other, and make more harmonized so they can get fast results. Best time, you know, for intercourse, some people, they just waited until they get ovulation positive. No, this is wrong. So because the first 4 days before ovulation, the day of the ovulation, and the second day after ovulation, total time is whole week, is the window period. And 4 days before ovulation, the chances of conception is significantly higher than on the day of the ovulation and after ovulation. So you have to educate the patient like this, look like this. 1 day before ovulation, 26%, 2 days before ovulation, 20%, 3 days before, 15%, 4 days before, 11%. Ovulation days only left 15%, second day after ovulation 9%, third day after ovulation 55% left. So of course, before ovulation more important. Okay, in our center, we did like analysis, like 165 patients with, advanced infertility patients over 35 years old. So we did that's only acupuncture and group, and acupuncture plus IVF, and acupuncture with herbs. And we found successful rate, only acupuncture without the IVF, without the herbs, 31% success rate. Acupuncture with IVF, 57%. And with herbs, 59%. This is 100% natural. So it's more successful, 59%. I think we don't have time. That we just, faster go over. Okay, that's because very important. This chart, BBT chart, can guide you how to use, acupoints and herbs. So that this is a perfect biphasic BBT chart, and this is from the period beginning until number 3. That's the ovulation time. After ovulation, temperature goes high, then keeping high level. Then the next cycle comes and temperature drops again. So, you can let the patient get fertilityfriend.com, download the form. So follicle phase, normally from the first day of the menstruation to the ovulation. That time the body temperature more lower, and the mostly reflect the patient's estrogen level. The production and the growth in eggs occurs during this period. That's why more important this time. So, and the luteal phase, the body temperature rises after ovulation, because the temperature should keep on the high level, which mainly reflect the patient progesterone condition. The follicle phase normally is maintained at 12 to 14 days, and the body temperature average between 36.3, 36.5. And the follicle phase mainly reflect patient estrogen level, the production and the growth of the follicle, and complete during this period. If this time the temperature too low, too high, too short, too long, all of them indicates, normal condition. So in the luteal phase normally after ovulation, the ovary response to the ovulation starts to produce large amount of progesterone. Then progesterone will affect to the central nervous system for the temperature, make the temperature goes high. If the high temperature too short, too low, then the temperature rises too slow after ovulation or drops too early, all of these kind of conditions are abnormal. This is normal. This is biphasic perfect chart. This is typically up, down, up, down, up, down. That's what we call qi stagnation of liver and heart. So this kind of patient, you don't need to ask, just see the chart, she's the, very stressful, very, upset, no patience. Oh, this is a 38-year-old girl, tried IVF twice, didn't work. And because they couldn't get out the eggs, didn't grow, and even with the stimulation, they didn't work for her. So they asked her to get donors, but her religion don't allow her to do that. So she came here. So we did treatment after 2 months treatment, and she got twins. So with natural treatment, acupuncture and the herbs. She got ovulation, say, first time is day 13, and the second day ovulation happened at day 17. 2 times ovulation, and both became to the embryos. So she got a good baby girl and a baby boy. This is a pregnancy PPT after 3 cycle treatment. That's a before treatment. Look at that, look like only one line. And 1 month after treatment, you can see got ovulation on day 18, and the luteal phase is still short. Then the 2 months after treatment, the ovulation earlier, day 14, and the luteal phase, longer. And the 3rd month of the treatment, she got a pregnancy. Okay, so Grace.
Yes.
So today's class, we just already 10 minutes past.
Wow,
So,
such an awesome webinar. Very informative, and we gain a lot. Thank you, Dr. Liang, for giving us such a useful and wonderful lecture. So now it's time for question. If you want to ask question, you can turn on your microphone, or you can type your question in the chat box. Yeah, any doctors want to ask question about gynecological diseases or infertility problems? You can type your question in the chat box.
Hello.
yes, go ahead.
These points are chosen for bilateral or unilateral, especially for legs point.
Sorry, can you repeat your question again?
Acupuncture points are chosen by bilateral or unilateral.
他意思说是要针双侧还是单侧是吗？针灸的时候，这样可以。
Okay, so like if like a young patient and not like over 35 years old, depends their condition, you can use like not necessary for both, but for advanced age, better to use both.
Okay.
Both sides.
Okay. So yeah, I have one question coming in. Hi, Dr. Liang. For the surround zircon technique, how deep is the kneading? Is it also beneficial for ovarian cysts?
Oh, yes, that's a very good question. All of the fibroid cysts surrounding needles technique help to shrink cysts. Yes. How deep? Depends on the patient's condition. If fat people, I use 2 inches long needles. If regular person, just use 1.5 inches. If thinner, very thin people, just use 1 inch.
Okay, any more question? Do you have a sample picture for this technique? Sample picture for this technique.
We will, if we have like a seminar, we will have that.
Yeah, Doctor. Actually, we have plans. We have plans to invite Dr. Liang to Malaysia this year to have the course about acupuncture strategy to treat infertility. So I think by that time, Dr. Liang will do the demonstration for all the participants. That's not a problem. So if you want to learn from Dr. Liang more about the infertility using acupuncture, which point, how deep is the insertion? So you please stay tuned in our WhatsApp group. We'll upload the information later. Okay, I have another question. When treating infertility, do you ask your patients to come several times a week so that you can give different herbs or acupuncture treatments depending on the menstrual phase?
Yes, normally, I would suggest for like advanced infertility patients, I request them to come here better twice per week. If difficult for them financial problem, at least once a week to get good results, because a different week, different treatment, the purpose, and it depends the stage, the different phases, the different treatment.
Okay, for the next question, for the electric acupuncture, we use 连续波 or 断续波. What is the unique for low frequency electronic?
The last question?
他是说电针 we use 连续波 or 断续波 when using the electric.
I saw the question that's normally how many cycle or treatments is needed. How many cycle? Okay, 3 months as one cycle, one course. So need 3 cycles for the whole processing. Of course, somebody get pregnant after 1.5 months, or somebody get pregnant after 2 months. For the difficulty, multi-factors like complicated cases, better, 3 cycles, because the eggs need 3 cycles to grow new numbers of the eggs. Okay, last question. Can you explain the electrical stimulation? Is the different phase 1 to 3? Or it's the same throughout the follicle phase? Okay. Well, for electrical stimulation, we can use like, after menstruation and during the follicle phase. And especially for people who have PCOS, and that you need more frequency electrical stimulation, especially during the ovulation time. Really need high, strong stimulation. Use heavy, strong points. And but if somebody like their cycle short, get ovulation early, and better do not give them stimulation. Depends patient condition. Do you use Moxa for any patient? Yes. And the moxibustion we use for patient who have like we call spleen qi and kidney yang deficiency. And if progesterone low, they always feel cold, lose hair. So that we use moxibustion. Any questions?
So no question? No more question? Once again, we already upload the PDF contents for today's lecture. So if you can't get it, maybe later I will upload in our WhatsApp group. And also, if you want to know more about the information about Dr. Liang seminar this year in Malaysia, you can also WhatsApp me, or you can get into our WhatsApp group. So that's my phone number, Grace Paul. So once again, thank you all for attending today's webinar. And there's one last question. How about those with recurrent miscarriage, doctor?
That's a very useful with the acupuncture for the miscarriage. I have a patient who had like a 12 times miscarriage frequency, recurrent frequency miscarriage. So even tried it 2 times IVF, didn't work, and she gave it up. And finally, her patient, her friend, paid money for her, and because she's so stressful, she's so depressed, and pushed her to come over. And so I said, you know, don't give up. She's 42, only one ovary. And I said, definitely I can help you, but I cannot give a guarantee. But this is not, this can be treated, and I can help you. So they said, I don't think so. So because, you know, I tried IVF, even didn't work. But yeah, I said, listen to me, nothing to lose. Why you don't try? If you don't try, you will, you know, lose the chance. Then listen to me. You can ask other patients. You can review, you know, my, you know, other patients, their, you know, like their internet online. So, you know, she did all of them, and then she said, yes, I believe I like to try. So that patient, as the first 3 months, and don't try because your eggs quality no good. So we need time to improve your quality eggs. So after 3 cycles, I said, oh, BBT at the beginning so low, and her progesterone very low. She lose hairs, cold all the time. So I did acupuncture, moxibustion, and herbs. You know, after 3 months, the BBT chart looks like perfect at that time. I said it's ready. So like we finished the preparation. So the first month, and then start to try because she's 42, husband 44. So I guided them which day we get intercourse, and I said even you try, maybe don't get a pregnancy right away. But she did. She got a pregnancy, and after that, but she's scared to death. She said, "Oh, I'm going to get a miscarriage again." I said, "No, because you already did acupuncture treatment with me." So I said, you know, but you don't need to come here every week. But she's scared, and I said, "Okay, you want, you just come over. I still give you treatment for protection." So I did the treatment for a whole month. 10 months, and she got a baby, a healthy baby boy, and beautiful, healthy baby. So that's definitely, it's our good treatment for miscarriage patients.
I think there's two question is very big. Where's the question?
Okay, that's like they have this is a special like conditions, actually kind of the autoimmune problem. For this, during the IVF, doctor always give them a treatment called the intralipid treatment. Give them IV. It's 2-3 times during the whole processing. So for us, and we just according to Chinese medicine, they just had some imbalance, some herbs very good to prevent this problem and correct this situation. Yes, we can help them.
Okay. So regarding the question about how do you treat patient after embryo transfer? Yeah, Dr. Liang have her own acupuncture methods to teach us how to treat. So this maybe Dr. Liang will share in the coming seminar. Yeah, it's a very informative seminar. We learn a lot from Dr. Liang.
We have so many cases because of the time. We don't have time.
Yeah, it's a very big question. Now we cannot answer now. And because of Dr. Liang, in US now already 10:30 night time. So Dr. Liang need to have a rest because tomorrow Dr. Liang need to go to work. So thank you very much for all attending today's seminar, and I hope everyone have a pleasant day. I also wish my Muslim friend here Selamat Hari Raya. Thank you for attending today's webinar. I hope to see you guys soon. Thank you.
Thank you.
Okay. Thank you,
Thank you,
everybody. Goodbye.
Thank you, Dr. Liang.
Dr. Liang. Thank you, Dr. Grace.
Okay.
Thank
Bye-bye.
you. Welcome. Bye-bye.